Okay, so the first question, Adrian, to you, the question time. So it says the emergency department is the heartbeat of a nation. Are we able to have resources? I can't quite remember. Are we going to be able to be revived? I think the question is.
Okay, so the person who wrote that obviously knows that our campaign this year our college campaign is resuscitate emergency care. You'll note that we don't call it palliate emergency care because I don't think this is unfixable. I would have said that the emergency department should not be the heartbeat of the healthcare system. It should be seen more as a canary in the coal mine, because actually what affects us are system problems either before or afterwards. And actually, if you would really need to think about what a good healthcare system would look like, we need to look to other countries. And this is actually rooting good care in primary care. Good primary and social care will actually do an awful lot more good for our population than throwing lots more money at hospitals or emergency departments. You need both, and I'm always going to argue for a bit more resources, but actually if we look at the graphs and the way we've gone as a healthcare economy, the investment really needs to go into primary care and into prevention.
Few GPs here tonight, you see, you can tell. So.
Read the room.
Thank you, Adrian. Dame Parveen, a question to yourself, if I may, is what would you tell your younger self now? What would you tell your younger self?
Learn to say no.
Learn to say no.
I think it's very difficult because I've had a very interesting and privileged, really, career. I learnt a lot. I think I always wanted to be a doctor, so whether I would have said, no, don't do it, I don't know. I wouldn't, probably not. What would you say? If somebody asked you, what would you say?
I would actually say yes more often. I know I don't want to compromise you, but I found that medicine is often about opportunity and leaning in, and I think that we have a responsibility to lean in and to lead.
Thank you very much to you both, thank you. Okay, so the next question, so I think either of you can take this one if it makes sense to Mike here. So next year it will be 10 years since the Snowy White Peaks report highlighting the scale of discrimination in the NHS with regards to ethnic minority individuals. How have things changed over the last 10 years? Better, worse?
It's a huge problem, isn't it? And I think you can't give an answer better or worse. People are talking about it, people are recognising it, people are prepared to train in it. We're having discussions within the college. We have an EDI committee. One of the things that we look at really closely is around differential attainment in our training and exams and career progression. And it's a complicated, fuzzy, nasty, difficult, wicked problem. But we watch it like the differential attainment around exams really carefully. And I think we've got much more scrutiny on this. I think the culture feels more inclusive. I don't think it's fixed at all, but I feel that people are prepared to talk about it in a way that we haven't seen necessarily when I started in medicine back in the mid-1990s.
Thank you, Adrian. I entirely agree with you. I just feel desperately sad that we're still talking about it probably at the same level. We talk about it, people know about it, but nothing seems to improve. I've just been a non-executive teaching hospital, and it was just little nooks and crannies which you just couldn't get into. And when you actually got there, they all were so frightened they wouldn't say anything about it. So it's sad that it's still happening. I think we are being bullied. I think there is discrimination that's been shown, both with sexism as well, as you saw in the reports about the surgeons, 1 in 3. So it's appalling, and I think we need to do something about it, particularly as now 47% of the NHS is ethnic minorities. And in terms of IG, international medical graduates, that's gone up to, I can't remember, but it's a huge amount. It's over 50%.
Thank you very much, both. We've got actually quite a few questions, so the proper time just for two more. I've got one question which must be from a consultant because I can't read it. So that has to be a consultant or a book, I imagine. So this one for Dame Parveen is, how can a good leader ensure good followers?
What a question. I think you can't ensure good followers, but I think if you're a good leader, you can actually see who is in your group and try and help them lead. In other words, build up their leadership qualities. There are lots of courses on leadership, and I never know whether they do harm or good. I'm a Catholic myself, I've been talking in leadership groups. But I think if you can set a rule or a way of how you can actually take forward what you're interested in, then you will get followers who will listen to you and take that on.
I think it's about giving people autonomy. So my background and my college career was all around quality, governance, and clinical governance. And that's how I got involved with college work. And I suddenly became president and I recognised that I actually don't know very much about education, and I don't know very much about exams, and I don't know that much about training and things that training programme directors and heads of schools do. So the first thing I need to do is surround myself with people who know about that stuff, because having that insight and awareness about your gaps, because you can't know everything about everything. It's impossible. But you need to surround yourself and give them the autonomy to do that bit of work.
Thank you. So the final question is, so for you, Adrian, I think to start with, can we get the NHS working at the private sector to save more money, and something about policies to save, and or should we be following the German or French model? So in short, can we get the NHS working more like the private sector to save money, and shouldn't we be following the German or French model?
Okay, so those are large existential questions. I'll talk a little bit about what we should be doing following the German or French model. People talk about, oh, we've got to change the NHS, change the NHS. The NHS is the most reformed, most reorganised public health system in the world, because it's so political, and every government that comes in wants to tinker with it and come up with some new reforms. I think the system that we have now got of ICBs and ICSs, which is actually based on a sort of European type model, which is federated, allowing local communities to have more say over what their local health priorities is the right one. I'm not convinced the idea of Whitehall, either through NHS England or DHSC, sending messages about and missives and plans, and there's a whole talk I could do to you about the futility and annoyance of winter plans and all the plans that come out of NHS England. So I think the strategy of ICSs and ICBs is the right one, but they need to be actually given the space to do it, and also actually the money to do it. Because we can talk about why can't we be more like France, Germany, or even the Nordics. Well, we don't spend enough money on it, and that's because we're not actually as rich as those countries. The other question about productivity and being more like the private sector, well, people have been talking about this for years. Yes, the private sector can be very efficient, and many people here who work more in the private sector. But there's case mix differences, and we look after patients, some of the most difficult and hard to look after people in our NHS hospitals. They may not be amenable to the sort of efficiencies you might get from the private sector.
Thank you, Adrian. So I agree with Adrian entirely about the first bit about looking at other systems. And remember, people come through different, so you can't really transfer one system onto another. and hope that it'll succeed in the same way. Secondly, I think where are we now? Well, I'm just co-chairing the BMJ Commission for the Future of the NHS, and it's a nightmare. So what you do want to do, and I think Adrian's point is something I was going to make as well, the government keeps changing and changing the system. I mean, we were told here is a system and Lansley set it up. He promised that he wouldn't change it. And then 4 months into government, he'd actually written it at the time he told me he wasn't going to change it. So we all changed, and we spent several billion changing, and then another system comes on. So I think the ICBs and CSs are a good idea. Let's stick with that. And I think, can we be the same? Can we be as efficient as the private area? The answer is no, because there's smaller numbers, and there's a pathway. What you forget with the NHS, and not only are you looking after patients, you're actually training all the healthcare workers, and that's on top of what you're doing, and then doing research and training medical students, training your junior staff. So it's a very complex system, the NHS. I would hope that we always keep the basic tenet that it's free at the point of entry, and that everybody has equality and equal chance of getting to what they wanted to do. Certainly when I was a youngster, we could send patients anywhere around the country for the best physician, surgeon, emergency, whatever you wanted to, and have get second opinions. It's now much more difficult because the movement of patients hasn't got bigger, and the local ICB is going to take over, ICS is to take over. So the answer to your question is, as we've given it, not a straightforward answer. We can't be like every other country, because the systems won't always fit. We can't be as efficient as private practice. You need a lot more money, and it's smaller and it's quicker. But I think we can improve the NHS. I think we are getting a lot of money. I don't think we need very much more if we rethink the way that we want to do it. Because I think otherwise we ourselves cannot afford the NHS. And I've been really, really sorry to see it go. I've been to, as I said earlier, of my travels, about 40 different countries. It's the best system. And it's about time we started saying to everybody, it is the great system, rather than saying, oh, it's awful. Don't complain, let's get on with it, let's try and make it work.
Thank you very much, Dean Kumar, Dr. Boyle. Thank you very much. And I think a warm round of applause for our fantastic speakers. And I think we should also give a warm round of applause for the NHS, in fact. Some of those words are absolutely true. The NHS is a fabulous system. It really is. Sometimes we just don't know how lucky we are and how good the system is. I know we have our challenges, but absolutely, I think the system of equality and everyone having access to the NHS, and certainly if you've been abroad, you've been to other countries where people can't afford the NHS, and if you can't afford it, then you simply fade away. That's what happens, that's the reality. So, absolutely fabulous system, and really, to our amazing speakers, fantastic night of inspiration. I know we can't fix the NHS tonight. Some of the questions were suggesting that we would fix the NHS tonight in this room. Maybe one day we will do, but I think this is the start of a journey, and certainly there's a lot of inspiration there for us to make those positive changes for our patients in our communities. So thank you very much, really. I've really enjoyed those lectures.